Hi, everybody. I'm Steve McGee, and I'm excited to bring this new segment. Today, I'm joined by both my partner, Dr. Greg Maguire, who I'm excited to have an interview with, and our head of education, Stephanie Brower, who's amazing, and she's going to be doing the interviewing. So over the course of time, we'll talk about different topics that are coming up in the marketplace, in the clinics room, that people want to know what's the real story to this. And we're going to start today by talking a little bit about exosomes and really what's the real story about exosomes. We're going to invite you to provide additional questions to us based on what we provide with you today. And with that in mind, let me turn it over to our head of education, Stephanie.
Hello, thank you. I am super excited for this new series that we're going to be doing. I think it's going to be great. There are tons of always changing skin concerns and things that are coming out about skincare. And I really think, I know I'm especially going to appreciate hearing the facts and the science from you, Dr. Maguire. And as Steve mentioned, yep, let's dive into it. I think one of the biggest buzzwords I have heard recently is exosomes. So I would love if you could just briefly describe exosomes and the purpose that they serve in our skincare products.
Yeah, thank you, Stephanie and Steve. Exosomes are really, you could call them a naturally formed by cells, a naturally formed liposome-like structure. So they're little fat balls with a hollow center, which contains a bunch of different molecules on the inside, and then molecules in this fat surrounding the center, and then actually some molecules on the outside. And the purpose of these exosomes is to protect the molecules on the inside. And also because it's this wonderful fat structure with a lot of molecules on the outside, the exosome allows penetration of these molecules through tissues. And so it's a cell-to-cell communication device. It's a protection device. It's evolved and developed in the human body, for example, these exosomes. And they're about, the ones we use are about 50 nanometers in diameter. So really teeny tiny little balls of fat with lots of molecules inside. And they've been evolved to work in our bodies at 98 degrees Fahrenheit. All kinds of different pHs. You actually find these exosomes in the gut where there's a pH of 2. And the exosome protects the proteins from enzymatic degradation. So there's lots of things in the body that could eat away at the proteins, and the exosome protects them. So it's really a wonderful, stable protection device and delivery device for a lot of proteins. I did a calculation. I have a book chapter where the exosomes that we use, depending on the size of the proteins and so forth, may contain up to 20,000 proteins inside the exosome. So it's a way for these proteins, different types of proteins, to come together, be delivered to a cell, and all these different types of proteins are delivered to a cell at once. And you get a synergistic effect when one protein is here, one protein is here, and they're turning on pathways together. It's a synergistic effect. So the exosome is really important for our technology. It's also big in drug delivery. It's a very hot area with a lot of funding, and drug development companies are heavy into it. We've been doing this for well over a decade, working on the exosomes.
Yeah, I love how you said earlier, you said that they are very stable. And I think that's one question I know I've heard a lot, and we've actually had some of our clinicians come to us, because there's a lot out there on the market that's saying exosomes are not stable. What would you say to that?
Well, they have to be handled in a proper way. And so this is exactly why NeoGenesis processes. We formulate and manufacture and sell all of our products. So you have to be careful when you use exosomes not to bring them to very high temperatures. They're designed to work at 98 degrees Fahrenheit, and they'll stay intact, certainly up to 120 degrees. But if you do things in your processing where you do so-called hot processing, where you're bringing temperatures up to, 270 and so forth degrees, then you can degrade these. The other thing is if you are mixing your formula and you use what we call a high shear, high speed mixing process, that instead of making waves, it's like cutting through the liquid, then you can cut through the exosome. So you have to be very careful how you process these. And if you are careful, they stay intact as they do in the body. The skin naturally has exosomes pushing molecules through the skin from cell to cell. And they're very stable, and they're stable outside of the body if you create the conditions for them to be stable. So not too much heat, not too much excess pH. We typically work in a range between 3 and 7, and the exosomes perform beautifully there. So it's a matter of how you treat them. And of course, when we put them in the packaging, we're very careful how we package them, what packaging we use. So with that, they're stable. The exosomes we know are stable for at least 2 years if they're at what we call room temperature, and FDA defines that as 76 degrees Fahrenheit. So they're very stable unless you don't know what you're doing and you process them incorrectly.
Right. So definitely handle with care, which we definitely do.
Yes.
What would you say to, because this is the other one that I'm hearing a lot of, that exosomes have to be frozen, or maybe they're freeze dried and that's how they're used. Obviously that's not what we do, but what would you speak to those that have the concerns of those freeze dried exosomes?
Yes, there's a well-known process in drug development called lyophilization. And basically that is a technique to deep freeze and dehydrate the material, in this case, the exosome. So you would deep freeze the exosome, pull the water out of it, and what you're left with is a powder. Well, we don't do that at NeoGenesis. Fresh is best. And here's the reason why. When you deep freeze and then dehydrate, that exosome has a lot of actually proteins, polysaccharides, all kinds of different molecules on the outside. When you do that lyophilization process, you denude the exosome. You take away these molecules on the outside, and you actually also to somewhat degrade what's on the inside of the exosome. So if you have the exosome still protecting, so if you do lyophilization and you rehydrate and then put it on the skin, that exosome will be missing some of the stuff on the inside. It won't work as well. But more importantly, the things on the outside of the exosome, those molecules on the outside that they're denuded in the freeze-dried process, they actually help the exosome penetrate and target cells that need the contents of the exosome. So it's like having a delivery truck. Your delivery truck is still intact when you freeze dry. The contents, some of the contents have been stolen, and then the handles to open the door have been stripped off by lyophilization, and the wheels have been taken off the truck, so you really can't get it to where it needs to go. So you still have some stuff on the inside of the truck, the exosome, but you're really not going to deliver anything well to where you need it. So we don't do lyophilization. It's very convenient for companies to do that because you can take a bolus of like our S-quared-RM material full of the exosomes, proteins, so forth. You can lyophilize it, take out the water, freeze dry it, and bring it down to a little pellet of powder. And it's cheap. It's cheap to store it. It's cheap to ship it. Instead of bulk being shipped, you just ship this little pellet of powder. So it's cheap. It's convenient for companies, but it doesn't work well. And therefore, we don't do it at NeoGenesis. Right. We like things that work well.
Of course. Yes, we definitely do. And so do all of our customers. So I loved the truck analogy. I actually really enjoyed that when I read the blog that you wrote on that, which we will link both of your blog posts on exosomes and the lyophilization of exosomes. But this has been a great start. I know we just kind of scratched the surface here. I'm sure we're going to have more questions come through. So I think this is going to be a really great series for all of our clinicians to tune into with lots of fun information. So I think that kind of takes care of it for me today. I don't know if either of you have anything else you'd like to add before we conclude.
Yeah, I just wanted to mention that where we're very fortunate at NeoGenesis, we're a science-based, evidence-based company. Dr. Greg Maguire is one of the most coveted research scientists in this industry. It's not Dr. Maguire speaking from opinion. He's actually quoting what the science shows in PubMed peer review papers. So you send us your questions. It's not an opinion that Greg is giving. He's really doing the research of what does the science actually say. And as Stephanie mentioned, so we've got links to blogs, we've got links to chapters in the book in this particular case, but those blogs, those chapters in the book, you'll see references to the science and the papers that reflect what Greg is summarizing for you. And that's what we're hoping to do for you, is to be able to take your questions, look at the science through Greg's ability to research it, and then Greg to give you a nice summary, but then have additional links that can enable you, the viewer, to do a deeper dive if you want to on the science itself. Does that sound about right, Greg?
Yeah, that's all good, Steve. And I would just add one last thing for further discussion is the S²RM technology that we have. It's not just the exosomes. There's more to it than that. So if you're using a product that's just exosomes, you're missing a part of the efficacy. We'll talk more about that another time, I'm sure, Stephanie, and I thank you for setting this up for us.
Absolutely.
Thanks, Stephanie.
In your time. I love it. I could talk this science all day.